Hi everybody, welcome to SRH Access Facebook Live. I am Lexi and I am here with Frisco Therapy Services Manager Laura Saleem.
Hello.
Thanks for joining us,
Thanks so
Laura.
much for having me. This is exciting.
Yeah, we are in our brand new sports therapy gym. As you can see, very beautiful. Lots of fun stuff in here to talk about. But first, Laura, I just want to start with, what is the difference between physical therapy and sports therapy?
So yeah, physical therapy all in its own is evaluation, assessment, treatment, and prevention of musculoskeletal and neuromuscular injuries. We also try to tie in some biomechanical deficits in that too. So what Scottish Rite is known for as a whole is pediatric orthopedic physical therapy. So they treat hip dysplasia, scoliosis, limb length deficiencies. They treat fractures and ortho, all sorts of stuff. So things that they've wanted to do outpatient services wise, they haven't been able to. So finally we're able to accommodate to that. So now working into the sports therapy realm, we're looking at treating the athlete. So somebody who's actually involved in athletics or is trying to return to a sport.
Okay, very cool. And so we treat both types of patients in this facility?
Yes, absolutely.
Okay. So do you want to take a little walk around?
Let's do it. I'd love to show you the place.
Okay, because there's a different area for physical therapy than sports therapy.
Absolutely, yeah.
Okay.
So here, I'll take you over across.
Sounds good.
So right now we're in the sports gym, obviously.
Yes.
And we have locker rooms for the early and later appointments.
Okay.
We have a shell space that will soon start the HydroWorks installation. So that is aquatic therapy, hot tub, cold tub, underwater treadmill.
Cool.
Super exciting. Our locker rooms.
So
and
people can change
right
in here if they come. For
there's
their
also a shower.
Mm-hmm. Oh, okay, nice.
So this is the Ortho Outpatient gym.
So PT and OT.
Yeah. So we've got parallel bars, again, for gait training of those prosthetic and orthotic patients that require a little bit more assistance. We've got big mats. We've got hydraulic lifts for those patients who are having issues with transfers or even mobility, things of that nature. But I'll show you over here. We've got our private treatment rooms.
Oh, great.
For physical therapy.
Wow, you guys have a lot of space in here.
Absolutely. So we do, the bars on the wall are stall bars, and they're for Schroth therapy or scoliosis.
Come take a look at this.
Scoliosis therapy, yeah.
This is very neat. So
Big
these
and
were the bars
spacious.
you're talking about.
Correct.
Right.
So the
what do you
mirror
do
behind,
on those?
Yeah, so the mirror behind will help guide the therapist and the patient, give them instant visual feedback of where their posture needs to be. If they have a curve that shifts them, they can try to work on techniques to help correct that curve.
Very cool. So how many of these individual rooms do you guys have back here?
So we've only got one for physical therapy, and then we've got one for hand therapy next door.
Okay.
So our hand therapist sees approximately 2 days per week, but she sees hand, elbow, wrist injuries, and she splints and treats in here. So it's a very nice, beautiful, bright space.
Yes. Very neat.
Cool.
All right. Should we head back into the sports
Yeah,
therapy gym?
that sounds good. So we'll head back this way.
And it's also, we should mention, Physical Therapy Month. So shout out to all of our Scottish Rite physical therapists for all their awesome work that they do.
Absolutely.
Here and in our Dallas campus.
All right. Alrighty.
And we've been open exactly 1 week. Today marks exactly 1 week since the opening of Scottish Rite for Children Orthopedic and Sports Medicine Center. So if you haven't checked us out, I know we've been saying this a lot, but Lebanon and the Toll Road, definitely come see it. It's beautiful out here.
Yes, it is. So just be sure, it says 5700 Dallas Parkway, Frisco, Texas, 75034.
Yes, Frisco.
So it should
not
be
Plano.
Right, exactly.
So you want to talk to us about some of this equipment?
Sure. So I think the highlight of our cardio area right now is the Alter G. It's an anti-gravity treadmill, and what it does is you put on these really cool looking spandex shorts, and you get into the actual bubble. We zip you in, and what it does is the bubble blows up around you, and it actually lifts you up off of the treadmill surface. So we can alter that to accommodate for weight-bearing restrictions or even athletes trying to return to sport or even running. So after your ACL injury or surgery, we can actually offload you to about 80% of your body weight, and then you can run and still get your cardiovascular training.
Okay, so starting back slowly until you can be full weight-bearing?
Yeah, exactly.
Neat.
Yeah,
That's
so
great.
One of the pieces we use quite a bit with every patient.
And you mentioned you guys are still waiting on some other equipment arrivals. You want to talk
Right.
about some of the highlights for that?
Sure. So we're going to be expecting a Skill Treadmill, which is a curved treadmill. It's self-propelled. It also has a sled function where you can actually adjust the resistance grade and you can push and use it like a sled to drive glute function.
I don't think I've ever seen one of those.
Yeah, no, it'll be great. And then we're also expecting a Versa Climber, which is, if you've never been on one, you'd wish you would never have been on one.
It's a great workout.
It's really tough. So it's basically a vertical climbing device that you're just working on cardiovascular.
Yes. All right.
So let's head on over here and I'll show you this. In the blue pads, we have what's called Kaiser equipment. It's a hydraulic-driven resistance machine group. So we've got the air squat, which helps drive glute function in a guided mobility pattern.
Okay, yeah, you can see the hydraulic parts right there.
And you can adjust the weight per the buttons, the yellow buttons. So this is called an air runner. And this, again, does the same thing. It drives glute function and in a running pattern. So as you can tell, it's angled right here so that you're in here and you're pushing and driving through your hips. We have a leg extension, calf press, hamstring curl, all pieces of equipment that will help us understand how much power and output the athlete is driving into.
And so for people that saw us in Plano before, are there a lot more options for things that we can do out here versus that space? Because I know that was a lot smaller.
Right, many more. So actually all we could have room for in Plano were these 3 machines and then our Matrix platform right here. So we've added a full another platform and more cardio equipment over there.
Very cool. And so as far as our therapists go, do we have certain therapists that do only physical therapy and certain therapists that do sports therapy? How does that work?
Yeah, so we have 2 orthopedic pediatric physical therapists, Cami and Courtney, and then we've got 4 full-time sports physical therapists. That's Lorenzo over on the turf. We've got Krista, Daniel, and Jessica.
Should we go check out what Lorenzo's doing?
Let's go check it out.
Hi guys, we came to check it out. This is Coco and Lorenzo. What are you guys working on?
Just trying to get her to understand how to come up on that single leg without letting her knee move inward. Trying to build a little bit of muscle strength on the quadriceps.
So strengthening the quad while working on biomechanics of the knee.
So we're rehabbing from a knee injury.
Correct. Driving into a posterior hip hinge and then up.
Great job, Coco.
Really good.
And so how does somebody make an appointment with you guys? If they see this, they see all this amazing equipment, and they want to get involved, how does that work? Do you have to be a patient at Scottish Rite? What is the steps?
So currently, yes, you do have to be a patient and seen by our physicians and providers upstairs, or even downtown as well. So we can do transfer requests if you live in the Frisco area or Plano, anywhere around here. You can definitely have that transferred up into our physical therapy department. And you'll check in with our front desk ladies, Natalia and Misty, and then we'll get you scheduled for your evaluation.
Okay, and you guys have different hours than just the clinic hours, is that right?
Yes, right. So we've been asked to kind of modify our hours to accommodate more for those after hours patients. So on Mondays and Wednesdays, we see patients from 9 a.m. to 7 p.m. And then on Tuesday, Thursday, and Friday, we see patients from 8 to 6 p.m.
Wow. And so if a patient comes, are they working with the same trainer or therapist each time, or how does that work too?
So usually that's how we like to do it. It keeps it very consistent, but sometimes times are really important to the patient, so we have to also accommodate towards that.
And I'm curious, so like Coco here, how often do patients come for their appointments? Is this like a once a week thing, or are they coming once a month? How does that work?
So whenever you are seen for your evaluation, the therapist will come up with a plan of care. And they'll discuss with you openly about what your deficits are and how to change them and how many times they think that it's appropriate for the patient to come. So that could be anywhere from 1 to 3 visits per week. And sometimes that can last anywhere from 4 weeks to 6 months as a duration. It just depends on the severity of the injury.
Right, because we treat all different types of injuries. Do you want to highlight some of the different injuries and things you guys see? Maybe
Sure.
is there a most common
There is
situation?
definitely a most common. It's patients with ACL surgeries or injuries.
Okay.
It's a big time deal around here. Lots of soccer athletes, basketball, football, even volleyball, you'd be surprised. But ACL is definitely our number one injury that we treat here.
And have you had any feedback from families on this great new space? Obviously, we've just been open for a week, so I'm sure people are coming in saying, wow.
Yeah, they're really impressed by the size of the space, all the new equipment that, some of the patients that were over in Plano and they transferred over here, they're just like, this is amazing. I'm so glad I'm still here. And I was a discharge prior to, but, it's the quality outcomes that we try to drive. So it doesn't matter about our equipment. It is fancy, but it's the therapists that make this place work.
That's great. And does your team, how do patients get discharged? I was curious about, you come here, what's the process for deciding that the patient is fully recovered? Do you guys work closely with our doctors on that, or how does that work?
So sure. For instance, if it was a surgical patient, or any patient, honestly, we would do the evaluation and then we would set our goals. So we have milestones in the back of our heads of when these patients should be able to achieve a Y balance passing score or HOP test score. So we do battery of tests with each patient load. But whenever we look towards discharge and thinking, oh, is this patient ready? It's kind of a team approach with the doctors upstairs and their staff, and everybody's usually on the same page. We do return to play testing as well for any of our ACL surgeries. So that consists of a Y balance test, a drop jump test, and then also a single leg squat endurance test. So it's a 60-minute visit that we do for research, and we're trying to figure out if any of those results correlate to re-injury.
Right, because as much as we love our patients, we don't want to see you back repeated times after you get all healed up.
Right.
So Laura, what are you most excited about for this new facility?
Honestly, I think it's getting engaged with the community and like reaching out and doing injury prevention, being more a part of the community, getting some residencies here in our own facility, just actually doing more with a greater staff. So we just have a lot of potential, and it's really exciting.
Yeah, we didn't really talk about outreach, but that's another part of what you guys do. Do you want to touch on that?
Sure. So eventually we're going to be seeing groups of people, whether it be teams or sports teams around the area, club teams, and usually what that's going to entail is some sort of our functional testing procedures, like a Y balance, which is, it helps us understand the difference between the legs. It gives us a percentage of functionality, and it tells us if there's a greater distance between the limbs. It kind of sets us off to, hey, there's a deficiency here.
Right.
How can we fix this and injury prevent? So there's a multitude of tests that we're trying to work around and try to distinguish for our injury prevention program.
That's great. Is there anything else that you want any patients or potential future families to know about?
Yeah, so if you're out there and you're listening to me, sports specialization is detrimental to your child. So please get them involved in multiple sports performance training, anything that involves more than just what their sport is, because they are kids, they're adolescents, and they're not skeletally mature. So if you take your phone for example, if you don't have the memory and the apps on your phone, it's kind of worthless. So if you're asking a patient without the strength, the ability, the agility, the power to do these specialized sports and call them elite, then you're actually not doing much, because they're just going to end up here and see us, unfortunately. So if there was anything I could say to the public, it's be sure to get your child enrolled in all sorts of different activities and try to not be so specialized.
It's definitely a balance. You got to find the balance.
Yes.
Well, thank you so much,
Yeah.
Laura, and thank you guys for joining us. We'll see you
Thank
next
you.
time.